Hello, my name is Jonathan Bachman. In this presentation, I will discuss my professional approach to caring for patients with religious beliefs in healthcare settings. Religion and spirituality influence how many people understand illness, suffering, healing, and death. Because of this, nurses must provide care that respects religious beliefs while maintaining professional and ethical practice. Throughout this presentation, I will connect concepts from course readings and lectures to explain how religious awareness improves patient-centered nursing. One important concept from this course is that religion often sits at the center of patient experience rather than on the margins. Religious belief frequently influences how patients interpret illness, make medical decisions, and cope with suffering. Faith can shape whether someone accepts treatment, how they interpret pain, or what rituals they want during hospitalization. Because of this, nurses must recognize that spirituality is not simply a private belief, but something that often appears through daily practices, routines, and treatment choices. Understanding this allows nurses to deliver more holistic care that addresses not only physical health, but emotional and spiritual needs as well. A key skill emphasized in the course is the importance of spiritual assessment. Nurses should not assume what a patient believes, but instead ask respectful questions about how faith influences their health decisions. Um, in some of our readings, Taylor suggests that nurses can ask patients how religion shapes their choices about treatment or whether certain rituals provide comfort during illness. Sometimes small actions can be very meaningful, such as providing time for prayer, allowing sacred objects at the bedside, or coordinating visits from religious leaders. These acts demonstrate respect for for the patient's identity and worldview. Supporting religious practices does not require the nurse to share the same beliefs. Instead, it requires listening carefully and responding respectfully to what the patient values. Different religions can influence healthcare in practical ways. For example, Jehovah's Witnesses may refuse blood transfusions because of their interpretation of biblical teachings. Muslim patients may prefer same gender providers and may need time for daily prayer or follow halal dietary rules. Sikh patients may keep turbans or uncut hair as part of their faith identity. Jewish patients may observe dietary laws and religious practices connected to the Sabbath. When nurses understand these beliefs, misunderstandings decrease and trust between patient and provider increases. This knowledge allows nurses to adapt care respectfully while still maintaining medical safety. Another theme from this course is that many religious traditions provide ways for people to understand suffering. For example, Buddhism teaches that suffering is part of the human experience and can be approached with mindfulness and compassion. Christianity emphasizes healing, compassion, and hope through the life and resurrection of Jesus. Hindu traditions often view suffering within the broader framework of karma and spiritual growth. These perspectives shape how patients respond emotionally and spiritually to illnesses. Nurses must recognize that healing involves more than treating symptoms. It also includes supporting the patient's search for meaning, hope, and dignity. An important challenge for nursing is balancing personal beliefs from professional responsibilities. Nurses may have their own religious views, but these should never be imposed on patients. Professional care requires culture, cultural humility and respect for patient, not an enemy. The nurse's role is to support the patient's spiritual needs without attempting to change their beliefs. This approach protects both ethical standards and patient trust. Whether a nurse personally shares a belief system or not, the goal remains the same, providing compassion, respectful care for every patient. My professional approach for religious patients focuses on holistic care. I believe that effective nursing includes understanding the physical, emotional, and spiritual aspects of a patient's life. In practice, this means asking respectful questions about beliefs, supporting religious practices when possible, and involving chaplains or spiritual leaders when appropriate. By recognizing how faith shapes meaning, identity, and coping, nurses can provide care that respects the whole person rather than focusing only on the disease. In conclusion, religion continues to play an important role in healthcare. Patients often rely on faith traditions to interpret illness, make medical decisions, and find hope during difficult times. For nurses, this means practicing spiritual awareness, respecting religious diversity, and supporting patient beliefs without judgment. When nurses listen carefully and acknowledge uh, what matters most to patients, they build trust and provide more meaningful, holistic care. One thing that I'd like to end with this is something that just happened recently in one of my clinical settings is that I am very religious and believe in God and believe in heaven and the afterlife and everything that involves with that. It's for sure hard for me to understand some patients that don't believe in anything, but I did just recently treat a patient that was has suffered um enormous amounts. Um, and when we went through the intake of this patient, there was a question about religion and if they have any religious beliefs. His belief, he didn't have one. He didn't think that there was any afterlife or anything like that. But I did enjoy that his one point, he was 65 years old, and he said that his whole goal is to make it to 100. I mean, the guy's battled multiple rounds of cancer, quadruple bypasses, hypertension, diabetic ulcers. He's missing some toes from his diabetes. But even in all of that, his view on life was to make it to 100 or 101, but to make triple digits. And so that was just cool to me to see, you know, for someone that has suffered so much, he still wanted to make it past a larger lifetime. Even though he didn't have religious beliefs, it was at least cool to see something foundational for him.